Dr. Crowder, welcome to the Valder Beebe Show. Hello, Stephanie. Thank you for both for being here. Can you hear me, Stephanie?
Thank you for having us.
Yeah, we can hear you.
It's my pleasure. We'll be talking about HCM, and I'm going to start off with you, Dr. Crowder. Can you explain what obstructive HCM is and its symptoms? And what is HCM?
Sure. So HCM is hypertrophic cardiomyopathy. Hypertrophic means thick. So in this particular condition, the heart muscle hypertrophies or becomes thick, specifically at an area where blood's trying to get out of the heart with each heartbeat. And so that causes an obstruction to blood flow. That obstruction can lead to increased pressures and backflow of blood in the lungs that can lead to the symptoms we talk about, shortness of breath that can occur mainly with exertion, exercise intolerance, that chest pain and pressure symptom that you may hear about, also can cause heart to race, to cause you to become dizzy, and in some cases you pass out from this condition. That's something that we call syncope.
I want my audience to know that Dr. William Crowder is a medical doctor. He's a board-certified cardiologist. Stephanie, I think you know something about HCM. Could you share your personal story in a synopsis format?
I will. First of all, we're just so glad to be here and partnering with BMS to highlight this disease for Heart Month. My symptoms really began in my 20s when I was told I had a heart murmur, but they didn't stop me from leading a really active lifestyle and becoming a marathon runner. But that's when my symptoms started in my 40s while I was running marathons with some of this chest pain and shortness of breath. And within just a few years, that led me to not being able to walk up a flight of stairs without having to stop and catch my breath. So that was a huge change in just a short period of time. Finally diagnosed in July of 2022, and that led me right to Dr. Crowder for treatment.
Thank you for sharing your story, and we're glad you're here to share it. Dr. Crowder, can you tell us more about the obstructive HCM, how it's treated?
Sure. So Stephanie came to me with a pretty classic presentation for this condition. So we jumped right into therapy. Traditionally, we use medicines to help symptom improvement, but in the past, these medicines have also required some surgical or more invasive type treatment options. Since 2022, though, Camzyos or mavacamten is a medicine that can reduce this obstruction, reduce the gradient that we're talking about, and improve symptoms through just the medical therapy. So it is with adults, for adults with the symptomatic obstructive HCM. So with initiating a therapy like that, we have to talk about side effects. We have to watch out for heart failure because heart failure can lead to death. So these patients are followed very frequently with echocardiograms or ultrasounds of the heart muscle to follow therapy and look out for some of these negative side effects. We have to discuss all pre-existing conditions with the patients, including pregnancy. We go through medicine lists to make sure there's no drug interactions. Everybody's different. Every patient is different. And so this process, this initiation, requires a nice, hefty discussion with the doctor and the patient.
Stephanie, I'm going to ask you one more question. I want to know how you're doing today and how were you treated?
I'm doing very well. I'm in the capable hands of Dr. Crowder. We decided on Camzyos for my treatment, and because of that, my symptoms have been greatly reduced. I know everybody doesn't have the same results, but I am back to being very active, walking, pottery, hiking. I'm back in the game.
I love that statement. Dr. Crowder, this is really important. I wanted to ask you a little bit off script, what role is technology playing in all these medicine coming forward for us to treat these conditions?
So not just treatment, but diagnosis. I think the technology that we see now, especially with imaging, Stephanie talked about having a heart murmur. Heart murmur has to be diagnosed, and we use ultrasound technology that's very non-invasive. It doesn't involve a lot of radiation therapy. And we can do these studies pretty much anywhere. There are echo machines that are on iPads now. So that technology has improved just dramatically in terms of trying to, diagnose these complicated heart conditions. So very good question.
Where can my audience get more information? Because I know you start with your primary doctor or, that's your starting place. But where do they get more information?
That's absolutely right about your physician or your provider. But the internet, obviously a big source of information, but camzyos.com is a nice website that has a huge amount of information about this therapy we talked about and this pretty complex underdiagnosed condition.
Dr. Crowder and Stephanie, I want to thank you so much for talking about such an important topic on the Valder Beebe Show. My audience is made of people born between 1946 and 1964. They're known as baby boomers, and this seems to be pretty prevalent within their scope of being who they are. So thank you so very much for stopping by the Valder Beebe Show. It's been my pleasure to share this information.
Thanks so much for having us.
Hi, I'm Valder Beebe, host of The Valder Beebe Show. We have over 1,000 videos on ValderBeebeShow.com and YouTube.com/ValderBeebeShow. We upload new videos daily. Our site is a modern baby boomer platform with news and information important to boomers. Subscribe to YouTube.com/ValderBeebeShow and stay connected as I interview the world's most fascinating people.